Tangazo watu waandulele wote naalikwa kwa kituo ya VCT iliyo huduma ya VCT kujua status yako ni bure.
In towns and villages throughout Kenya, this is becoming a familiar and welcome scene. Family Health International and the government of Kenya are bringing HIV testing to remote regions of Africa, focusing on popular gatherings and getting people talking about HIV and prevention. On a continent where HIV is still one of the leading causes of death, FHI brings education and testing to those at greatest risk.
So he's saying
One is we had a meeting the other day with a pastor because it is 26 years since HIV was reported here. And we are trying to create awareness. We are trying to create awareness among us, our youth, our wives and our families, so that we try to create awareness for prevention and reduce infection and issues of prevalence.
The mere presence of our mobile testing units gets communities talking about HIV/AIDS transmission and protection and encourages people to cross that barrier and get tested.
Jina yangu inaitangwa Steven Nachu. Niliona mimi kulingana vile niko, nijipime.
In just moments, Stephen Nachu will know if he is HIV positive. Testing is the first step toward preventing HIV or getting treatment, care, and support, and many are here to be tested. But health officials know of one family that isn't. They're in need of immediate attention. FHI health providers travel into the countryside where the family lives. This is the home of 47-year-old Winja Olamayuma. He's lost 2 wives and 3 children, most likely from AIDS-related illnesses. Now, he and his 4-year-old son are ill too. Winja and his 5 remaining children live day to day with an unspoken fear that one of them may be the next to die. Today, FHI health providers offer to test the family for HIV, a first step in getting them help.
Ni mzuri kupima. Ikipanda madamu mzuri. Najua maisha ikipona ndio maisha. Sababu hata mimi nalala hapa. Kila siku nalala hapa. Hakuna mahali taenda kutafutia hata hao. Siyo maisha mbaya. Mga ikizonia besidai. Nikiwa nagara sidai. Kwa nagara natu mwejikina karibu watoto 9. Gara na udu. Mangara ari. Namara datu ula yukari. Negezonia na bagisidega kiwa na mwijana kumaisha torono.
His son Julius and daughter Kaleu reflect on better times past and today's tougher challenges.
Yara bankishu 100, nara interage senje 200, nara meara dua bento kinemeti enkang nakata. Saatake peeponu olorere amuoi neponu moja aishunye naa nkaraki ina moyian olorere mirakini aya sipitali.
Yara duo entoki nikiyierr amu mekiata enkurma netu duo ele siai neeku meeta entoki nikiyierr. Keeku ake teipa nikipuo airura.
Pima mimi.
Winja is the first to get tested.
Hiyo. No, nachukua tena hii.
Sini sana.
Na tulisema ikitoa laini 2.
Dagwa iko.
Now that Winja knows his status, He wants to make sure all his children get tested.
Bye-bye.
Nasho, unaona hiyo?
Yuko ba Maasi.
Winja's youngest son tests positive. The FHI team continues to test the rest of the children.
Unajua tunapima nini? Nini? Virusi vya ukimwi, si ndio? Si unajua iko mahali kushinda hapa kwa boma yenu? Na kama iko tunapima kila mtu. Si ati kwa sababu mko nayo. Tunataka kujua. Saidia ni kidole.
Chukua damu yangu yote.
Unasikia kama hata imetolewa damu kweli?
Mama naona.
Nimemaliza yako.
Young people aged 15 to 24 account for 45% of all new HIV infections in adults. FHI is working to lower that number through testing and prevention programs.
Sasa kila mtu ashike result yake ndio ini ana. Ini huyu. Na ingine mkono ingine. Ukikuwa negative,
all three are negative.
By delivering the medical workers as well as the testing equipment and materials, you can get individuals in those remote areas tested and ultimately treated and cared for.
Today, Winja and his youngest son are receiving treatment and care for HIV, and they're responding well. Stephen Nachu has gotten good news too. He tested negative. Family Health International is spreading the word and reaching people about HIV testing even in the most remote regions of Africa. But there's still work to be done.